I think having ASCO Direct highlights here in the greater Denver region is important, given that we're quite uniquely situated in the middle of the country. People talk about sort of the major academic centers across the country, things like MD Anderson or some of the University of California centers. Out east, you have Dana-Farber Cancer Institute, Memorial Sloan Kettering, and these sorts of things. But where we're at in Colorado, we're kind of the main sort of academic stop, at least in terms of the University of Colorado. We also have, the luxury of having a lot of different, options here within the region with, different cancer centers throughout the region. And so, I personally don't view it as a competitive marketplace per se. I think there's more than enough space for all of us because at the end of the day, the goal is to ensure that patient care is first and foremost. And so whether they're seeing someone where I work at the University of Colorado or one of the other private institutions to seek their cancer care, making sure that sort of we're all well integrated from a networking standpoint, such that we know who our colleagues are, being able to meet them here at ASCO Direct highlights, share patients. Sometimes if we have clinical trials at our center versus they might have different options at theirs, and to really sort of work towards a nice collegial atmosphere such that we're able to provide the best care for patients with GU malignancies moving forward. Having an event such as ASCO Direct highlights as well gives us all an opportunity to kind of rehash and review the data. Going to ASCO annual meeting is always a massively overwhelming event. Things are coming at you fast and furious, and you may not have had the opportunity to kind of review the data, even if you were sitting live during the auditorium or watching it later, on the virtual meeting. So being able to kind of think through things, bounce ideas back and forth off our colleagues, and sort of revisit the data and see sort of how we might apply it in terms of patient care, I think is critically important for us in the region.